So how do we optimize brain health, right? If the bare minimums are hydrate, sleep, and eat, if those are our bare minimums, what do we need to do to optimize brain health? What is that next level that we can take, especially if I'm an athlete preparing to go into a season, or I am, I'm just trying to make sure that I'm doing everything that I can to make sure that my brain is healthy enough to function. In my net, in my scope, in my kind of bias, I talk about brain injuries, right? I talk about concussions, persistent post-concussion syndrome, traumatic brain injuries. I talk about that. But when we talk about optimizing brain health, these are things that we can do to help minimize the risk for dementia and Alzheimer's, to help minimize the risk for traumatic brain injuries like aneurysms, and to doing everything that we can to make sure that the brain's healthy. And as we age, that we've already established that the brain is healthy. That way, if we do encounter some of those unfortunate situations, like a neurodegenerative disease or God forbid, a brain tumor or something along those lines, or an aneurysm, that we've done everything that we can before the event to make sure that the brain is healthy enough to kind of move forward and do what it needs to do to continue to progress in its brain injury recovery.